This pandemic has challenged all of us in many, many different ways. It is natural to feel frustrated, anxious, and eager for the situation to change. It is understandable to have different opinions about the measures in place, the responses we take, and how to move forward. But cases are rising. We have no choice but to keep working together and keep following the measures in place, even if you disagree with them, for a little while longer. The recipe for getting safely to summer is simple. We need to reduce cases sharply by limiting in-person interactions as much as possible every day. We need to stop the spread for just a few more months so that vaccines can do their work. We are getting closer to this every day. Over the last 24 hours, we have identified 1,081 new cases of COVID-19 and completed about 12,000 tests. Our positivity rate currently stands at 8.9%. We have identified 705 additional cases of variants of concern in the last 24 hours. Variants currently represent about 52% of our active cases. There are now active alerts or outbreaks in 453 schools, which represents 19% of all schools in the province. A total of 2,653 cases have been linked to these schools since January 11th. We are seeing a sharp rise in cases in school-aged Albertans as well as those in all other age groups. While there are no risk-free options with COVID-19, the rise we have seen is not attributed to any single cause, and in fact is often linked to social gatherings outside school rather than transmission within classrooms. This reinforces the importance of following the measures in place, not only during school hours, but before and after them as well. There are now 402 people in hospital being treated for COVID-19, including 88 in the ICU. Hospitalizations are increasing province-wide, and cases continue to rise sharply. My team is monitoring closely, and if we do not see growth slowing soon, further measures may be required. Sadly, I must announce that 3 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family, friends, and loved ones of these individuals who are mourning their loss, and to anyone who is grieving a loss at this time. These vaccines work, even against variants. The evidence available indicates that all 3 vaccines that we currently have, Moderna, Pfizer, and Covishield's AstraZeneca, effectively stop the variant that's most dominant in Alberta, the B.1.1.7. Vaccines are our best defense, and once we have been able to offer them to all in the province, the current wall of protection created by public health measures can be replaced with this wall of protection that the vaccines give us.